People sometimes wonder whether, when they are feeling out of breath, whether that is a panic attack. And it might be. What we would have to really evaluate is, when is that happening? What kind of situations? Does it only happen when you're feeling more anxious? And does it get accompanied by all those other anxiety type symptoms as well? Or is it just shortness of breath that is happening, and that's happening all the time? Hi, I'm Colette Hirsch, and I'm a professor of cognitive clinical psychology here at King's College London, and I'm also a clinical psychologist at the South London and Maudsley NHS Trust. I'm going to be talking to you today about panic attacks. I think the majority of people will have a panic attack at some point in their lives, but that may well just be a one-off. It's when you start worrying about having another panic attack and avoiding situations because you might have a panic attack that you could really think about whether you want to talk to your doctor or a psychologist to see whether you have a panic disorder or some other type of anxiety problem that has panic attacks as part of it. So when we as clinicians think about a panic attack, it's probably slightly different from how people might term it in sort of day-to-day life. So people might say that I'm having a panic when they're just feeling a bit flustered. I suppose what we think about a panic attack is when there's a rush of anxiety and lots of anxiety symptoms that come on very quickly, for example, within a 5-minute, 10-minute period, and feel really intense and overwhelming. Now, the symptoms that you might have as part of that panic attack will again vary from person to person, but frequently include heart racing, feeling hot, sort of butterflies in the stomach, feeling nauseous, feeling kind of confused, and also thinking that maybe you're going to lose control, even that you're having a heart attack or you're about to die. So there are these different negative thoughts that go on, as well as these symptoms themselves, but the negative thoughts are kind of a symptom of the panic attack as well. You can have a panic attack in different situations. So you might have a panic attack because you have something called, say, social anxiety disorder. And when you're feeling very anxious in a social situation, it might be that you have this spike of symptoms, and that might be a panic attack. But that will be seen as within the social anxiety disorder. You can also have situations where you just have panic attacks out of the blue and you can't really see a reason for them, and that would be more associated with something called panic disorder, where people have had a couple of these panics out of the blue and they worry massively about having another one, and at the time they are very, very frightening for the person. They're thinking that something catastrophic is about to happen. As I say, it might be a heart attack or losing control or dying in some way, which would be extremely anxiety provoking in its own right. People can feel anxious and very high levels of anxiety, but that would often be for a prolonged period of time and caused by a particular sort of potential threat. The panic attacks, these things that come on very, very quickly, and as I say, within panic disorder, they seem like discrete events that seem to have no reason, but it just seems very, very frightening that something terrible is about to happen right now, whereas anxiety might be about something that might happen in the future, or something that's already happened before. So it's sort of the imminence, immediate, it's terrible, I'm going to have a heart attack right now, rather than something later on. The reason that people end up having panic attacks and that they keep going can often be to do with their thoughts and their thinking habits, and also their response to the situation. So in terms of their thoughts, when you have a physical sensation and your habit is to notice what's happening in your body, but you then interpret that in a negative way. So my heart's racing, that means I'm having a heart attack. That's going to make you feel really frightened, because anybody in that situation would feel frightened if they thought they were having a heart attack. So then you will have more symptoms, and then you'll make more negative interpretations of those symptoms and be more convinced that this catastrophe is about to unfold. Now, sometimes people then will do something to kind of save themselves, and these are called like safety-seeking behaviours. So, for example, someone might choose to sit down or hold on to something because they might feel dizzy, and they think that the only reason I survived that situation was because I sat down or held on to something, not realising that they would have been okay anyway. So there are these safety-seeking behaviours that would be occurring in lots of different anxiety problems, but they will also be occurring in people when they have panic attack. But again, they're putting in place and avoiding situations that they don't need to. In terms of a panic attack, let's just sort of think about what's happening. You're getting a situation where, for example, you notice a symptom in your body and you then interpret that negatively as a sign of something really terrible's happening, for example, a heart attack. And one of the points that you could intervene is to be able to realise, in fact, no, that's just my heart racing for some other reason. It doesn't mean it's having a heart attack. So you can begin to test out and explore different interpretations and be able to think, this is just my body reacting. It's not something that's really dangerous to me. And very importantly, you can also not do the safety behaviours, because the safety behaviours are these safety-seeking behaviours, and you're thinking the only reason I survived was because I sat down, or I held on to something, or I did certain type of breathing. And in fact, it isn't. It's just that you would have survived anyway. So what we want to do is begin to sort of change your response to these situations, as well as making sure that you don't avoid situations. So working on the thoughts, the deliberate response to situations and not avoiding can help reduce the kind of panic cycle and try and have things happen differently. And that's what cognitive behaviour therapy would help with, by working with the therapist to kind of explore what really drives your panic attacks and how could you respond differently. So it's a difficult one, and obviously you can talk to your GP, and that would probably be, or doctor, would be the best bit of advice. But if they say it's anxiety, then it may well be that you're experiencing a panic attack. The good news is that you can get medication or have psychological treatment. The treatment of choice for panic disorder is cognitive behaviour therapy, and that really can change your life, and you can be choosing what you do because you want to do it, not because you're fearing that you might have a panic attack. So good luck.